So in the last NeuroTouch video, you would have seen me talk about Dura and what that Dura trauma and compensation can do to your body. So I just thought I'd take the time now to talk about Sam, one of my clients that came to me that had had multiple falls off horses, about 6 car accidents in the last 40 years. So this is an older client issues have been going on for quite a while. And she just wakes up every morning and is constantly in pain and has to really keep her body moving. It's like warming up your truck. She felt like she had to warm herself up before any of that pain would be able to subside. So through her treatments, what we found was a lot of nerve compensation through the lower back. So whenever we work on those nerves, we're looking at them off the joint of the vertebrate. So as you might have trauma to your lower back or things going on in your lower back, but when it hits that nerve, what it's doing is it's actually impacting through to your hip and your pelvic ligaments, as well as some nerves go all the way down through your knee to your top of your shin, as well as the biggest one going all the way from about your L3 joint all the way down to your big toe. So that's when you can get a lot of that transferring pain or overall leg weakness just because of an impact to your lower back. So there was a lot of compensation through to that, because then we had to go through and look at her pelvic ligaments. So all her trauma, obviously coming off horses, she was always landing on her tailbone. As well as just being a competitive rider with horses, she just had so much pelvic ligament strain that a lot of her issues were arising from all those weakened pelvic ligaments, and they're really essential in just helping to keep your posture straight as well as your flexibility and being able to bend and get that flexion extension in your spinal column properly. So we found a lot of the trauma through the right side of the pelvic ligaments, coming into the groin to the top of the pubic bone, coming all the way around to the tailbone as well, and just slight compensation coming up on the left side, but mainly all that trauma hitting in the tailbone and that side of the hip. So we were able to clear that, which was awesome. And one of the other big traumas that really stood out to us was diaphragm on the left side. So when we work with your diaphragm, we're actually working with your karua muscle. So your karua muscle comes up from your L2, comes up and actually forms your diaphragm. So that's a lot of not necessarily shoulder bending, but being able to keep your ribs away from your hips and that posture. Again, this was actually from a car accident and the seatbelt causing so much trauma and pressure to the diaphragm that whole muscle had been compromised for the last 20 years and had actually started to impact her lungs. So we do look at trauma on gland tissue as well. So we did find a lot of compensation through the lungs and the tissue around the lungs. So by correcting all this, we've taken away that pain in the morning. She's got more flexibility and she's actually able to breathe better, and she's noticed that she's getting less headaches. So that's just a little bit about what Dura can do. Whether you've had lots of high impact sports or injuries or accidents, it's just really good to get a good full run through of how your range of motion is in your body and where they could be causing more stress to your nervous system. So that's just a little bit on Sam and her success with working with her trauma and compensation. And I absolutely love seeing clients, poor starting point, but walking slowly into the room and being able to leave after a couple sessions and nearly running out the door because they've just got so much more energy and range of motion in their body.